Hi, I'm Ruth Hopkins. I'm Dr. Ruth Hopkins, and I am the Postgraduate Programme Director for the MSc Public Health and Health Promotion here at Swansea University. First of all, I'd actually like to give you an overview of the course, and please feel free to post questions as I'm speaking, and I will try to answer as many questions as I can in this short space of time. Now, the MSc Public Health and Health Promotion at Swansea University has been running for 20 years. It's a very successful programme, and we are fortunate in that we are able to accommodate students who come from a medical background or a socio-economic public health or environmental health background. The programme is such that it is flexible to allow you to develop your skills in public health and health promotion, no matter what your background is. And you can be guaranteed that when you leave this programme, you will have the skills you need to actually put your knowledge into practice within your chosen area of public health or health promotion. Now, the programme at Swansea University runs over 1 year full-time, 2 years part-time, or 3 years part-time. The 1 year full-time programme is very attractive to our international students and has been very successful for our international students. If I tell you a little bit about the modules and the time you will spend at university, whilst it is 1 year, it is intense, but not as intense as other programs. And 1 year doesn't mean that you are at university 5 days a week. If you undertake the course 1 year full time, you actually have 2 full days a week contact, and that is Wednesdays from 9 o'clock till 5, and then Fridays from 9 or 10 o'clock till 5 o'clock. The rest of the time, that's Tuesdays, Thursdays, and Mondays, you are expected to do private study. We do 8 modules in total, and each of the modules are 15 credits. So I'll tell you a little bit about each module. On a Wednesday in the first semester, you do Foundations in Health Promotion, and I lecture in that. That's 10 o'clock till 1 o'clock on Wednesdays, and in that module we cover the theories of health promotion. We look at health promotion in multicultural populations. We look at trans-theoretical change models, theories of behaviour change, social marketing theories, and we ask you as the assignment for that programme, for that module, to critique a health promotion initiative. Now, you can critique any health promotion initiative. It can be something that is found on a digital platform, a poster, anything, as long as you're critiquing it with health promotion theory, and you're actually saying what is good and what is bad and what you would improve about that health promotion initiative. We've had some excellent ones from Saudi Arabia. I particularly enjoyed reading an assignment from a student who had critiqued the diabetes health promotion initiative, which was put out on Saudi Arabian YouTube equivalent. In the afternoons on a Wednesday, you do epidemiology and public health evidence. This is also a very theoretical module, and you essentially learn how to critique research papers that you read. What is good research and what is bad research? And for this assignment, you have to critique 2 different methodologies. A qualitative and a quantitative methodology, and you can pick a subject of your choice. On Fridays, during the first semester, the module is Developing Programs and Evaluation, and in this you are asked to develop a public health and health promotion initiative. And then on Friday afternoons, you do public health ethics. Now, the public health ethics is an essay, and the developing programs and evaluations, essentially, you have to develop a health promotion initiative. Then in January, on a Wednesday, You do foundations in research, and for this assignment you have to write a research proposal. And what is good about this assignment is that you can actually feed this research proposal into your Part 2 dissertation. You also do a module in the afternoons on Wednesdays then, Management and Leadership for Public Health Practice, and the assignment for this is to write a management report, and you have to present a management report. And then Friday mornings you have health protection. This is also a module that I lecture in and is one of my specialities. And in health protection we look at outbreak control, and this can be anything from Ebola to a rabid dog, to an outbreak of Legionnaire's disease, to a radiological incident, to food contamination, anything that is health protection. And on Friday afternoons you spend on placement. Now the placement module encourages you to go out to a public health setting and experience public health and see how you apply public health practice and health promotion practice within a working environment. And the assignment for that is a placement report, and that's very exciting. We have had students that have had placements in a cancer charity. We've had a student that spent her time at a refuse collection. We have had students that have observed breastfeeding initiatives, health promotion initiatives in schools. Students generally really enjoy the health promotion and public health practice placement module. The pass mark for every single module is 50%, and when you have successfully completed all 8 modules, you move on to the dissertation. Now, the dissertation requires you to do an original piece of research, and the research can be anything related to public health and health promotion. You can undertake the research in a country of your choice, or you can undertake the research here within the UK somewhere. If you are researching and you'll be questioning, or your participants will be humans, you will need to go through the College of Health and Human Sciences ethics approval, and then you can undertake your research. If you're going to be doing something like critiquing a website, you won't need to go through ethics approval. The wonderful thing about this public health and health promotion MSc is that it's attractive to people who come from a medical background or a socioeconomic background. And every assignment you can develop to suit your particular area of interest. We do not force you, if you are a socio-economic public health practitioner or want to be a public health practitioner, to take everything from a medical perspective. And if you are a medic, we do not force you to submit assignments from a socio-economic or environmental health perspective. And this is why this course is so attractive. The program is delivered through a series of lectures, seminars. We have group tutorials and practical sessions. And each session is designed to enhance your learning. And we try to use as many methods to enhance your learning opportunities. I personally am your personal tutor throughout the whole of the program. When you undertake your dissertation, you are assigned a dissertation supervisor who will be a specialist in either qualitative, quantitative or mixed methods research. The entry requirements, we require a 2-1 or equivalent, but we would also like those people who don't quite have a 2-1, who might have a 2-2, but who have got relevant experience within the field of public health to also apply. That could include people who have experience of working in a socio-economic public health background, or people who come from an environmental health background. Now, because we have a mixed group of students within the program, internationals and home students, there is a very good mix of students, so there is a reciprocal arrangement of learning. Home students learn a lot from students who come from the international perspective and students who come from the developing world. And students who come, international students or students who come from the developing world take a lot away from home students. So there is this very wonderful reciprocal learning. The other marvellous thing about this is that there are no age barriers. So we have more mature practitioners coming onto the programme, and we have younger, newly qualified graduates, let's say, coming onto the programme. So there is also that cross-generational learning that goes on. Health practitioners impart all their knowledge and their practical experience to our new graduates, and our new graduates actually, they give a lot of IT skills to the more mature students. So there is that great reciprocal learning. If you want to apply, what we would like to see on your personal statement is your passion. Your passion to be a public health and health promotion practitioner. The key public health challenges of the future are obesity, an aging population, which is to be celebrated because we are combating those communicable diseases. All right. So aging is a challenge, obesity and climate change. If you are interested in public health, please put on your statement, your personal statement, where your passions lie, and give me some idea of your experience within your field. If you have worked in housing, that is relevant to public health, because with poor housing, you will have poor health. If you're a medic and you would like to come into public health, remember, some of the greatest improvements in the public's health have not been through just vaccinations, but you have to look at the wider determinants of health: housing, food, nutrition, water, sanitation. These are all key elements to improve public health. If we have a quick chat now about career routes, once you've qualified successfully and you've got your MSc in Public Health and Health Promotion, I can comfortably say that every single student that graduated last year has now walked into work. We've got a couple of students that have now been offered 2 jobs and are emailing me to help them to decide which one to accept. But you can work within the field of public health. Some of our students have gone to Public Health England, Public Health Wales. We have a student who has gone to work as a statistician with the Communicable Disease Surveillance Centre. 3 of our Saudi students have been fortunate to get promoted within their current workplace, and that makes me very happy. Those who are in practice as well here in the UK also move up the promotion ladder. One of our American students is now setting up a health promotion initiative for fentanyl and drug overdose cases. She's setting up a health promotion and rehab program. Another American student has set up a couple of years ago a program to deliver health promotion to young girls from the age of 9 to 16 who have body dysmorphia, who are not confident about their appearance and who are developing depression through their non-confidence with their appearance. So all the students we have moved into really excellent jobs that are well paid. We have got one student now who's decided that he wants to go into teaching, and I think that would really suit him because he really is a people person. What else can I say about this course? Swansea is a safe, friendly city to live in. The university has got fantastic facilities. It's on a great campus. We are right by the sea. You will find the staff here, particularly on my program, are very accommodating, very supportive and very helpful. I always say to my tutees that I am their mother away from home, and they can approach me with any problem they have, even if they're feeling homesick. So do come to Swansea University. Think about doing the MSc Public Health and Health Promotion at Swansea University. I should tell you really the difference now between the Masters of Public Health and the MSc Public Health and Health Promotion. The Masters of Public Health is very medically led. So it is slightly more restrictive if you are a person from an environmental health or a public health, a socio-economic public health background. So the MSc here at Swansea in Public Health and Health Promotion is actually a more rounded course. Please apply. Thank you.